This is another sign of the times, an analysis, and a commentary. The coronavirus pandemic. Luke chapter 21, verse 10. Then he said to them, Nation will rise against nation, and kingdom against kingdom. There will be great earthquakes, and in various places famines and pestilences. And there will be terrors and great signs from heaven. One of the most common questions asked of health experts about the new coronavirus is some variation of how worried should I be? It's a complicated question for two reasons. Why it's so complicated. First, while global knowledge of Covid-19, the disease caused by the new coronavirus, is growing every day, much remains unknown. Many cases are thought to be mild or asymptomatic, for example, making it hard to gauge how wide the virus has spread or how deadly it is. Second, much of the risk comes not from the virus itself, but from how it affects the societies it hits. For most people, the disease is not lethal. Health officials tend to put it somewhere within range of an unusually severe seasonal flu. Even in a global pandemic, it's expected to kill fewer people than the flu virus. Data so far suggests that if you catch the coronavirus, you may be likelier to have no symptoms at all than to require hospitalization. The coronavirus is thought to be much more dangerous for people over age 70 or with existing health conditions. This is also true of the flu. But because the coronavirus spreads widely and quickly, it can overwhelm local health systems in a way that the flu does not. This is thought to have driven the unusually high mortality rate in the region of China where the coronavirus first spread. Officials, unprepared for the outbreak, were caught without sufficient hospital beds or healthcare workers, meaning that many people who might have survived with better care did not. In South Korea, where officials were better prepared, the mortality rate has been a fraction of that in China so far, about that of the flu. But the disease's spread, along with measures to contain it, is also bringing disruptions that even the worst flu does not. Economic slowdowns, supply chain disruptions, school closures, public transit restrictions, and mandatory work-from-home policies all exact tolls, whether you get sick or not. In other words, this is different. Government measures to limit the coronavirus's spread can increase some burdens. In Italy and Japan, school closures have required parents to stay home from work for weeks at a time. That brings a financial cost for families that need to miss work or hire help, as well as an educational cost for children out of class. Transit restrictions and other measures bring more hardship, particularly for part-time workers who can't rely on paid time off. It all adds up. Economic disruptions can be severe as well. If supply chain breakdowns worsen, it could become harder to find products that rely on parts or materials from affected countries, which in today's globalized world could be almost anything. A global slowdown, even a brief one, means layoffs at a time when governments will also have less tax revenue to fund social safety nets. At the same time, a pandemic means that virtually everyone could face unusually high healthcare, childcare, and elder care burdens. Much as the virus's direct impact on your health depends on your personal details, such as your age, any systemic risk from an outbreak also varies based on your personal context. if you live someplace with good governance, along with plentiful health care and economic resources, the risk to you is likely to be lower. The state will be better able to absorb any societal and economic burden. And if you fall ill, to ensure the appropriate care. As in Italy or Japan, people in wealthier countries may also be able to rely on government-funded assistance. But if you live someplace where state and society function less effectively, the consequences are likely to be greater and the burden pushed onto individual families. And economic slowdown might also be more painful and longer lasting. Part-time workers like restaurant servers or Uber drivers will feel more consequences. Any time off is likely to be unpaid and the financial toll harder to absorb. Many may feel greater pressure to keep working even if they have an existing condition that makes COVID-19 more dangerous. People in poorer countries may also be more vulnerable, as Iran's example shows, if health services are more easily overwhelmed and families are less able to absorb any financial hit. As is so often the case, people who live in wealthy countries, who are wealthy themselves, who have good protections at work, will be much better positioned to ride things out. Maybe it's easiest then to think of this as less of a seismic shift in global circumstances than a deepening of one of our era's most consequential trends, in which the well-off are cushioned and protected, while the burdens are pushed onto the poor and the working class. In other words, a story of inequality older than the novel coronavirus. It's also about what kind of world are we leaving to the future generations, and that should be a very important question to ask. Luke chapter 21, verse 10. Then he said to them, Nation will rise against nation, and kingdom against kingdom. There will be great earthquakes, and in various places famines and pestilences. And there will be terrors and great signs from heaven. And all these are more signs. Yes, it's time for prophecy to be fulfilled. Again, what kind of world are we leaving to the future generations? And that should be a very important question to ask. Then he said to them, Nation will rise against nation, and kingdom against kingdom. There will be great earthquakes, and in various places famines and pestilences. And there will be terrors and great signs from heaven. And all these are more signs.